Good morning, Holly.
Good morning, Dargan.
And good morning to our webinar attendees that we have today. Thank you for joining us on the Senior Network. I am Dargan Davis, and I am with Senior Resources, and I'm joined today with my co-host, Holly Van Horn from Lori Life and Health. And we are excited to hear from today's speakers. We have Erica Cheeks, who is going to be joining us from Harvest Hope Food Bank, and she is the Director of Healthy Food Access and Choice. And we also have Danielle Jones, who's going to be joining us from the South Carolina Department of Social Services, and she is the Public Information Coordinator. So we're very excited about today's series. It's going to be on nutrition services in South Carolina.
Great. We're going to give our guests a few more minutes to get logged in. And if you're new to the Senior Network, we'd love to know where you're from. You can drop us your hometown in the chat box. And we'll be back in just a few minutes.
Welcome to the Senior Network, and thank you for joining us today. I just have a few housekeeping notes before we get started. This episode is being recorded, and it will be available later today on our website at seniorresourcesinc.org, and it will also be available on our social media channels. Before we begin, I would like to take a minute to introduce Senior Resources to you and share just a little bit about the services and programs that we offer. Senior Resources is a nonprofit organization that coordinates programs and services for senior citizens living right here in Richland County. All of our activities, services, and programs are all geared towards helping seniors live in their homes as long as possible through the support of staff and volunteers. We have our largest program is Meals on Wheels, and we serve 600 homebound seniors and disabled adults with a daily hot, nutritious meal to the client's home. We also have a home care program that provides personal services in the home, and we have a transportation service, which is Senior Wheels, which provides door-to-door transportation to doctor's appointments, to the pharmacy, and other medical-related trips. We have a Pet Pals program that provides a monthly supply of pet food to our Meals on Wheels clients' homes. And we also have 4 wellness centers that are located throughout Richland County. And this is where seniors can go and gather and have a hot meal and fellowship with their peers and participate in physical fitness activities. Most recently, one of our new programs is our Senior Lunch Bunch program, and that launched in 2021. And this is an opportunity for seniors in the community that do have a way with transportation. They can come and meet at a local restaurant and have some time together once a week and enjoy a hot meal along with fellowship with each other. And then also the Senior Network is another one of our new programs that we are offering here at Senior Resources, designed to connect seniors virtually in the comfort of their home to more community resources. I'm going to turn it over to Holly, and she's going to tell us a little bit about Lori Life and Health.
Thank you, Dargan. Good morning, everyone. I'm Holly Van Horn. I'm the Community Relations Coordinator at Lori Life and Health. And it's great to be back with you for another webinar. I hope you're enjoying this series. And we are so proud to partner with Senior Resources to provide these informative speakers to you each month. I'd love to take a minute to tell you a little bit about Lori Life and Health if you're not familiar with us. We are an independent insurance agency based here in Columbia, and we specialize in Medicare, health, and life insurance. And our mission is to educate you on all the options available and help you make a choice, a decision that meets your needs and your budget. We can assist you in person or over the phone, and our services are at no cost. You can find more information on our website, which is www.lorilifeandhealth.com. And now it's my pleasure to turn it over to today's two speakers, one from Harvest Hope Food Bank and the other from South Carolina Department of Social Services. Good morning.
Good morning, everyone.
Good morning. Well, we are so excited to have y'all today.
Same here. It is a pleasure being able to present today on Harvest Hope Food Bank. My name is Erica Cheeks. I am the Director of Healthy Food Access and Choice at Harvest Hope. I've been here for 22 years, and basically I help establish collaborative relationships with external partners, agencies, and colleagues in the communities that we serve. I focus on the gap areas, rural communities, communities of color, and all of the outreach programs that we do. We're here to provide support as well as capacity building for our agencies and partners. And we are very strategic in food and economic equity across the board. So we began in 1981. It was a shared vision. It was actually a food box program, which is why you still see our emergency food pantry. Most food banks do not have an emergency food pantry. They are just a food bank. So there are only really 4 food banks across the nation that have their own on-site emergency food pantries. Everyone else just brings the food in and it goes out through their partner agencies. We cover 20 counties in the Midlands, PD, and Upstate. So we have 3 warehouses. We're actually moving into a new one in the PD in the upcoming year, and it's right across the street from the new Buc-ee's that will be built. So I'll definitely be taking a trip up there to go to Buc-ee's, if anything. But our mission is to transform lives in the communities we serve. That is the most important thing. We have to be able to take all of our clients, whether they're children, families, seniors, and transform it so that they are able to cope and provide for their own families. That is the goal. And I know that's what everybody's goal is, to have everybody self-sufficient. So, addressing food insecurity, building a healthy and hopeful, hunger-free tomorrow, that is our goal. Next slide. So 1 in 9 neighbors face hunger in South Carolina. Now, all it takes is some kind of pandemic or something, and that number will fluctuate. So right now we're at 1 in 9 neighbors, and our goal is to get it to 0 neighbors in hunger. That is the ultimate goal. And I tell this to people all the time. We've been operating since 1981. We have not cured hunger yet. So what do? Those are why we have the different programs to try to help alleviate hunger so that everyone has equal access and can provide for their families, take the hunger part off their plate, and they're able to deal with the medical bills they may have, job searches they need to do, all of those other things. And we don't want food to be an issue with that. Next slide. So here's our service area. As I said, we cover 20 counties. The Greenville warehouse covers Greenville and Lawrence. And then, of course, here on the Shop Road facility, we serve all of those counties out of this location. And then the PD location serves those. If you look at the gray areas, Harvest Hope is not the only food bank that serves counties in South Carolina. There are actually 3 other food banks. At the top of the state where you see Spartanburg, Cherokee, Union, York, and Lancaster, that is actually done through the Second Harvest Food Bank in Metrolina, which is out of Charlotte. If you go to the left side of the picture, Pickens, Oconee on down to Aiken, Barnwell, Allendale, that is done by the Golden Harvest Food Bank, which is actually located in the Augusta-Aiken area. And then on the other side is the Low Country Food Bank, which covers the Low Country counties. So we all work together to make sure that the people of South Carolina are fed. We are not the only food bank, and I think sometimes people think we are, We just have the most counties that we serve out of the state of South Carolina. Next slide. So as food banks, like I said, most don't have an emergency food pantry on site, but food banks are basically the warehouse. We bring in millions of pounds of food each day, and we use our partners to get them out in the community. Our partners are food pantries. They provide the bags of food, the actual food to the clients. Some can be mobile, some can be set facilities at churches, but food banks versus food pantry, there is a distinction, even though a lot of people kind of interchange them. Next slide. So we partner with over 330 agencies in our 20 counties. They are at-risk schools. We do a backpack program, homeless shelters, soup kitchens, churches. Probably 90 to 95% of our partners are churches, actual churches that run programs in conjunction with Harvest Hope and coming to get the food product from us. Next slide. So children, that is one of our main focuses. We do the backpack program where the kids receive a backpack the last day that they attend school for the week, and that carries them over until they come back on Monday. It only operates during the school year. Once the school year ends, then it goes to summer feeding, which is through the Department of Ed. But we also do mobile pantries, and I'll explain a little bit more about that, where we provide food boxes and we actually take them on a truck to various locations so that they can be distributed out in the community. Those are done in rural areas because even though we have over 330 agencies, we do not have enough agencies in each county to cover it well. So that's why we do mobiles. We do anything we can to get the food out. We also do families, of course. Most people have an idea that a family is a single person household, and that's just not true. The face of what families are is your typical everyday person that you see walking around. You never know somebody's circumstances. Two-parent households, both parents working. It's so many things that are going on. So we're here to provide service for anyone who needs assistance. Another big one, which probably about 10 years ago, it opened my eyes with military and veterans. Most people assume that the military and the veterans have all of these resources, so they don't need any help. Well, when they were calling up the National Guard for different things, we realized, talking to the wives of some of these men, that the husband was a self-employed person. Once he got called up, that was their income. She didn't work. They had young kids. And that was like an aha moment for us, that regardless of what you think someone's status is, there are still gaps where they need assistance. So we help do mobile pantries. They come here, we get calls from COs, and we put packages together. Same thing with law enforcement. We talk to the chaplains. Anytime we can help anyone, that's what we're here for. The big category that we see, of course, and everybody sees it across the board, are seniors that live on fixed income. High medical bills, the skyrocketing prices of groceries, and they're also taking care of their grandkids. When you look at the income that they have to live on, and they also have young kids, we've seen seniors in their 70s taking care of 2-year-old grandkids or great grandkids because their kids are either incarcerated or some other thing happens. And that's a lot. So we provide different programs to try to help our seniors out because they worked all their life. Now they're retired, and it's kind of a slap in the face to them because, you know, being at Senior Resources, I know you get clients that they will sit and talk to you. They love to talk. They want to express themselves, and they want to tell you what's going on. So we're kind of a sounding board as well for them. Next slide. So just briefly, you know, we secure the food. We have tractor trailers and trucks that go out to the grocery stores, to the different food service industries, and pick up product and bring it back. We also have partner agencies that do it depending on where they're located, and they take it back to their facility and distribute it out. Our job is to secure food, to make sure it's safely stored, which is one of the things with our partner agencies as well. And before I forget, we are constantly looking for new community partners to help distribute food. So if that fits your bill, give me a call and we can get you connected with whatever program works best for you and your client base. Next slide. Like I said before, we have to safely store and ship the product because the clients that we see that come to the food bank typically have medical issues. So you don't want to provide something that's going to make them sicker or cause them to lose life. So we're really big on food safety. We all have to be trained on that as well as our agencies. And we have to make sure we're doing our due diligence when it comes to the product that's donated to us. Next slide. You can go through that. We've talked about distributing a product. So basically, we're here to serve and support. We cannot do this by ourselves. With covering 20 counties, we have to have the community support and the community's help. You are the ears on the ground. You know what's going on the day-to-day. It's particularly if you are dealing with seniors or if you're dealing with the children. You know what the needs are in your community. And that's what we rely on for you guys to come to us and say, hey, this is what's going on. How can we help them with X, Y, and Z? And we work it out. We will make sure that we get food and other services to you. That's what this whole network should be about. Next slide. So food insecurity, basically it's the lack of consistent access to enough food. Not that you're hungry today, like, hey, I didn't eat breakfast and I'm hungry. That is not food insecurity. It can be temporary, but it can last for a long time. So that's one way that Feeding America, which is our parent organization, that's how we gauge where we need to be in communities, the high rate of food insecurity. Next slide. So like I said, we know what it's like to be hungry after skipping a meal, but how do you measure that? You know, it's different. You know, there are certain conditions, and that's what we focus on to try to make sure the food is taken off the plate so that they can focus on those other conditions to help alleviate the food insecurity. Next slide. All right, so seniors. And you can read through the percentages, like seniors are 3 times more likely to have depression, more likely to have asthma and be diabetic, all of those things that we all know are true. So we have multiple programs. You can go to the next slide. Multiple programs that help us. Slide this. All right. So the diabetic food pantry boxes is one of them. We started that program because Lexington Medical Center had a support group where the lady running it realized that a lot of clients were going to the food bank. Well, the food bank, we received donated product, but we can also purchase product. You cannot give diabetics breads, pastries, produce, all of this unhealthy stuff. So she came to us. We talked to Lexington Medical Center, and we have some other fundings that do it in other counties. And we do diabetic food boxes, same thing, similar with the heart healthy, so that those clients that come to the food pantries can receive those boxes to help with their disease state. So that would help them reduce recidivism, going back into the hospital all the time, all of those things. We also do senior boxes. The senior boxes are a federal program. It's called the Commodity Supplemental Food Program. The Department of Ag heads it for the state of South Carolina. The seniors have to be 60 and over, and it is income-based. Once they qualify, then each month they get a 40-pound box of non-perishable food based on, it's a supplement, based on the nutrients that seniors need, plus a 2-pound block of cheese. Now, really, the seniors love the cheese. All the other stuff you can keep, but it's necessary for their diet. But that cheese, you better have that cheese with that box. We talked also about the Child Nutrition and Backpack Program, which we do healthy backpacks with the fruit, oatmeal, pop-top items for them, so that if they are self-sufficient at home, parents are working and they're latchkey kids, then they can prepare this meal themselves, quick, pop it in the microwave, and it's good for them. We provide nutrition education and on-site symposiums, especially with our agencies, each year, providing food safety training, all of those things that they need to be able to operate their programs out in the community. We do roundtable discussions. You name it, we are in it, trying to make sure that everybody is well versed on what we do and what they need to do to make sure their programs operate efficiently. Next slide. So at our own emergency food pantry, because we see so many families each day / each month, they get a cart full of shelf-stable product, as well as fresh produce, meat, breads, and we allow them to come to us every 30 days. However, they can visit our partner agencies as well. But because we have so many at our physical locations every 30 days, and then they're referred to partners in their area. And you can go on our website, put your zip code in, and it'll pull up all the partners that are close to you in your zip code and the services they provide. Next slide. Like I said, the CSFP is 60 years of age, and it is a supplemental box. One of the questions we hear if they go to an emergency pantry, they are eligible to get the senior box plus the pantry food package. So it's not just that senior box. We provide them with all resources that we can. Next slide. So of course, you can volunteer, you can donate, you can host a food drive. If you've never been to Harvest Hope, contact me. You can come take a tour. We do packing events on Saturday. You name it, we do it. I'll come out and speak, whatever you need. You can send me an email and I will definitely get back to you. Next slide. And that is it. And I think you'll probably either save questions for later. But thank you guys so much. And definitely, if you have any other questions or anything that I didn't address, you can contact me. For our senior program, we do have 3,438 seniors on that program we do each month. So that's across our 20 counties. And then each year, the Department of Ag reviews, and we can request additional slots through the federal CSFP program. So each site that we have, and we have 51 sites, they all have an active caseload and a waiting list for seniors to be on the program. So, and that is it. Thank you, guys.
Ma'am,
Yes.
I have a question. Naturally, I'm an insurance agent. I work with a lot of folks on Medicare.
Uh-huh.
I would like to get together with you to figure out how I can best serve my service area and getting this information to them. I deal with a lot of folks who are on the poverty line, and I want to know what I can do to become a source for them.
Okay. Who am I speaking with?
My name is Greg Lucci.
Okay. All right. We will connect after this.
Okay.
All right.
Yes, and we can get that information to you, Erica, and you'll be able to have his contact information. So thank you for that question. We appreciate it.
Thank you.
All right. Well, I think it's now time to hear from Danielle, who is going to be joining us from the South Carolina Department of Social Services. Danielle.
Good morning, everyone. Thank you for having me. My name is Danielle Jones, and I'm the Public Information Coordinator for the agency. And today I'll be discussing one of our popular programs, which is the Senior Farmers Market Nutrition Program. There's a couple of changes this year, but we'll get to all that. Next slide. So essentially what the Seniors Farmers Market Nutrition Program is, it is designed to provide participants with fresh, nutritious, unprocessed fruits and vegetables from local farmers markets. It also opportunity to increase awareness and use of community markets. This year, the program actually runs from June 1st through October 15th. October 15th is actually the last day that once seniors receive their vouchers, that is the last day that they can use them. Next slide. And just to clarify the partnership between the Department of Social Services and the Department of Agriculture. So farmers who want to be included in this program, they would need to get authorized by the South Carolina Department of Agriculture. Once that happens, then they would come through DSS to be trained. Next slide. Okay, so essentially what the Senior Farmers Market Nutrition Program does. So for eligible seniors, participants will be able to receive 5 $5 checks, which will total $25, and they would use that to purchase fruits and vegetables from local farm distribution sites, which are authorized through the Department of Social Services and the Department of Agriculture. Next slide. Okay, so who's eligible? This program is also income-based. You have to be age 60 or older. Also, when you sign up, do the application process, it has to be within the county that you reside in. This year will be a little different from the past 2 years that we've done this program. Because of the pandemic, we had to kind of switch the application process online. And so this year, we'll be going back to our pre-pandemic way of doing things. So they will actually be doing the application process on site. And so we're in the process of updating our distribution sites, which viewers will be able to find on our dss.sc.gov website. Also, we have working with a lot of partners, the Department on Aging, people like Senior Resources, who will be handing out flyers that will have that information where you can go to fill out an application. Some of the eligibility requirements, as I said, this is an income-based program. And so once you go to fill out your application, you need to bring an ID. They'll self-declare the amount for household income. So those are all the things you need to have with you in order to get the vouchers the same day. So this will be a little different from, like I said, we've done the past 2 years, where you do the application online and then you go pick up the vouchers, or they're either mailed to you. So this year you'll be able to go to the distribution sites, fill out the application, and get your vouchers right then and there. Next slide. Okay, and so this is just an example of what the check would look like. This year's check specifically is green, so that's how you know you have the right one. Also make sure the dates are correct. So October 15, as I said, is the last day for seniors to be able to use those vouchers. Also, just to be clear, these can only be used at authorized distribution sites. You can't go into the grocery store and use them. They have to be used at authorized distribution sites. And they don't necessarily have to be in that same county. You have to do the application in which county you reside in, but you can go to another farmer's market in another county and you can use those vouchers there as well. So important to know, make sure it looks green. And also make sure that the dates, October 15, 2022 and October 31st, 2022. Those dates are the dates that need to be on your check once you receive those. Next slide. And just some benefits from this program. It's very important. Yes, this program is essentially to help low income seniors, but as well as helping out local farmers. South Carolina is an agricultural state. So this is an opportunity for them to get more customers, profit from it. Also, like I said, there's an opportunity to bring new customers to these farmer sites, help those small farmers increase their income. Also, this is help plan for better utilization of farm resources and help to broaden customer base for repeat businesses. Next slide. And so this is some of the contacts. If you have any questions, South Carolina Department of Agriculture, Chris Doyle, he'll be able to assist those farmers. Here at the Department of Social Services, Willie Nixon, he's actually the program coordinator for that program, Seniors Farmers Market Nutrition Program. And so if you have any questions or concerns, he'll be able to assist specifically with that program. And just a couple of things that I missed. I want to make sure that all seniors know this is an annual program, but you have to reapply every year. So just because you applied last year, that doesn't mean that you'll automatically be able to do the program this year. It's important that you apply each year if you want to get those vouchers. And like I said, the two biggest things, instead of online process, the application process will be done in person this year. Also, normally in the past 2 years, we've started the program in May. This year, it'll actually be in June. So June 1st is when the application process starts. And that is all.
you. We're going to check and see if we have any questions quickly from our audience.
There is one question. How do food stamps affect the persons qualifying for these benefits? If either Erica or Danielle want to chime in on Mr. Russell's question.
So for Harvest Hope, they self-declare their income. All of our programs aren't income-based. That CSFP senior program is, but if a client comes here, once they review what their income is, if they don't qualify for that program, they still have access to the donated product that we have coming in. So we don't turn anybody away.
And that's Willie, who I spoke about being the program coordinator. He commented, so you will be able, if you're on SNAP, you'll be able to also receive the vouchers for the Seniors Farmers Market Nutrition Program as well.
Great.
And Danielle, I believe this one is for you. Gregory has asked, where do we get the application? Can you just explain again that the applications will be at the distribution sites?
So we're still working on finalizing some of the distribution sites. Once we get that finalized, that will go on our website, which is dss.sc.gov. And then, like I said, we have a lot of partnerships that we're working with to help get out flyers and so forth. They will have those applications on site that you can fill out. So you'll be able to one-stop shop, fill out the application and get your vouchers the same day, opposed to, like I said, the past 2 years, we've had to kind of, rework the way we've done things because of COVID. You had to do your application online and then later get your vouchers. So you'll be able to do that all on one site. But we're still working out the details as far as all the authorized sites that you'll be able to do the application. So just keep an eye out for that. Hopefully closer to the application start date, which is June 1st, we'll have that information finalized, and we'll be passing that information along to Senior Resources. We'll have that on our Facebook page, on our DSS website. If closer to that time you don't see that information, like I said, Willie Nixon, he's the program coordinator over that. You can give him a call, or myself, I can add my contact information and we'll be able to tell you what site you need to go to do the application and pick up your vouchers.
Thank you for that, Danielle. And we will also distribute that information on Senior Resources Facebook page. We usually try to put a lot of details out there right around the time that the program kicks off June 1st. So you can check Senior Resources on our Facebook page, and we'll have information about the Farmers Market Voucher Program as well. So great.
Thank you.
All right, well, I think this is about wraps up this episode of the Senior Network, and we want to thank Erica and Danielle for joining us today, and all of our webinar attendees. We're really excited about next month, and so we want to make sure that you be sure to tune in. We're going to have Attorney General Alan Wilson on here, and he is going to be talking to us about avoiding scams and frauds with older adults, and that webinar will be Thursday on June 2nd at 10:30 a.m. We already have the registration available for that webinar on our website at seniorresourcesinc.org. And we will also have today's episode also on our website and our Facebook channels later today. So Holly, once again, this was a nice informative session learning about nutrition programs here in South Carolina, and we hope that you join us next month.
Yes, this concludes today's webinar, and we'll see you in June.
Thank you.
Thank you.
Thank you.